Okay, day 5 of why living in Europe is better than living in the USA. And this is a big one. It's universal healthcare. Let's go through some statistics. First off, let's look at universal healthcare worldwide. 69% of the worldwide population has universal healthcare. Most everybody in Europe does, as you can see from that zoom in image. The US doesn't. And look at this stat. This is some sobering information here. This is life expectancy versus health expenditure per capita. Look who's the most expensive over there on the right, the USA, but also one of the worst life expectancies versus all these other countries above that have universal healthcare, and there's less healthcare expenditure per capita and people live longer.
I just had a patient tell me that him and his wife got quoted $30,000 to go through IVF treatment here in the United States. So instead, they are flying to Spain, staying for 2 weeks, making it a vacation, and doing IVF, all for $15,000. And keep in mind, he has insurance here in the United States, so that was with his insurance. And there, they don't have insurance. This is just out of pocket. So the out of pocket cost there, altogether, the trip, everything, $15,000. Make that make sense. Like, why? How? What is going on here? Healthcare just shouldn't be this inaccessible and inexpensive, especially, and keep in mind, he has insurance.
As you know, one of the reasons we moved from the United States to Europe was healthcare and its affordability, on top of other things. So right now we're here with our nanny and baby, the checkup at a private clinic. Absolutely gorgeous place. Basically no lines, and the visitation is $50 for a doctor, $60 for a specialist. Absolutely dirt cheap compared to the United States. And this is a private clinic. If you get on board with the government program, all of it is free, but then you have to wait a while. So these places that you see here are basically next day or the same week appointments. No insurance, no monthly premiums, none of that BS. And also, doctors here are quite forgiving. They're not pushing on the jabs. As far as the level, the equipment, the standards, and everything. I mean, I know this is just a lobby, but let me tell you, everything is nice, clean, professional. I would even say that it's probably nicer than most American doctors' offices that we've been to. Even ensure that you're wearing these little booties that automatically go on your shoes. I've never seen that in the United States. Have you?
Yes. No. They are now arguing that they made our healthcare more expensive for our own good, folks. Just watch this.
You need to have a system that does both, takes care of you when you're ill and you're sick, but also incentivizes you to adopt healthy behaviors that keep you healthier and keep you out of the hospital. When there is a copay and a deductible, there's some skin in the game. Patients don't overutilize, and they're more likely to adopt healthy behaviors.
If y'all don't hear from me in the next 24 hours, someone should start a bail fund, because this single clip is going to turn me into the actual Joker. Also, for legal purposes, so the FBI doesn't show up at my front door, that was a joke, you nerds. Because not only is that patronizing as to essentially suggest that Congress's job is to make life harder for Americans because that will somehow make us more responsible as individuals, it's also just straight up not true. We know this because countless studies have already documented what happens when people lose access to health insurance or the cost of healthcare goes up. You want to know what people do, Marionette? They fucking die! Or, to back up a little bit, first, they just stop going to the doctor at all. In fact, about 1 in 3 insured adults and 3 out of every 4 uninsured adults say that they have delayed or skipped needed medical care entirely because of cost. Higher out-of-pocket costs are associated with underutilization of essential care, reduced treatment adherence, and as a result, more emergency room visits. In other words, creating financial barriers, the very thing that Marionette was expecting us to thank her and her party for doing, do the exact opposite of what she is claiming. She's suggesting that people paying higher deductibles and copays will make folks feel like they have some skin in the game and therefore will take better care of themselves. And just pause for a moment and really think about what she is claiming here. To believe that that is even remotely possible, you would first have to believe that Americans are only sick because we just can't be bothered to take care of ourselves. Not to mention, what the does it even mean to suggest that people need a little skin in the game on this? I cannot think of anything more skin in the game than your literal skin, your entire being. We're talking about healthcare, Marionette, people's literal lives. Do you not think that Americans have a vested interest in our own ability to stay alive? On top of that, if having healthcare cost us money out of pocket had any positive impact on people's health or health behaviors, we would already be the healthiest nation in the developed world. But in reality, we consistently rank among the sickest nations in the world, while our healthcare spending vastly exceeds what other countries are spending. But, by all means, if Marionette and her party want to roll into the midterms telling Americans that we should thank them for their service of making our healthcare worse and more expensive, go right ahead, sweetheart. But don't say that we didn't warn you. Just like we've warned you for years about what taking a wrecking ball to our healthcare system would actually look like.
What if getting sick didn't mean worrying about bankruptcy? More Americans are comparing healthcare systems around the world and asking why patients in many European countries often pay far less out of pocket for medical care. So the question is European healthcare system really better, or are people only seeing one side of the story? Let's watch more clips and we'll come back to talk about it.
I know we all know that the healthcare system is better in Europe than it is in the States, but oh my goodness, I keep getting surprised. I don't know if this is TMI for this app. Having a gyno appointment in Spain is like the best experience ever in comparison to what I had to deal with in the States. And if you're a guy and you have no idea what I'm talking about, ask your girl if you're straight. She'll definitely know. She's probably had one once in her life. And if you're a girl and you've been needing another reason to visit Spain, go for this reason alone. Because I know that the experience differs from doctor to doctor and person to person, but at least for me, when I went in the States, I passed out within 0.5 seconds. I remember this overwhelming sense of just cold. The nurse taking care of me did not at all have bedside manners. I remember she had to bring in smelling salts just to wake me up, and then I had to go through the whole process again. When I tell you this was one of the most traumatizing experiences I've ever had, it made me never want to do it again. And if you're a girl, at least how I was raised, I think it's a pretty necessary thing to have a checkup at least once a year. But because of this experience, I literally didn't go back, and I was very reluctant to go back when I moved out to Spain, and it took me literally until yesterday to even go. But when I tell you this was such a good experience, the woman had proper bedside manners, the communication was on point. She even turned the ultrasound thing towards me and was like, look, it looks like you ovulated 15 days ago, and then starts describing to me what is going on inside on the screen. And I'm sure you can experience this in the US, but I didn't get that when I went in for my gyno consult. All I got were smelling salts in the nose after I passed out and the worst thing shoved up inside. But out here, it took all of 5 minutes, not even, and quite literally the most painless process ever. So again, if you need another reason to come visit Spain, go for this reason alone if you're a girl. I know it's kind of taboo to talk about these kinds of things, but it's so refreshing to know that there's a country that you can go, have a very invasive exam done, and feel absolutely comfortable while doing it.
You're not struggling, you just live in the US. I moved from the US to Europe and I plan on never going back. The main reasons are because life is just stress-free here. The food is really fresh. Like even fast food is way healthier than the US. And I can afford a full-time nanny, house cleaner, but there are things that I don't like about living in Europe. Number one, the etiquette. The etiquette is completely different than the US. Here, everyone is really stern. Not a lot of please and thank yous. Like if you go to a restaurant, they're not going to introduce themselves. They're just going to take your order and go. But that's probably because they get paid a living wage instead of relying on tips for survival, like in the US. 2, the smoking. Everyone everywhere is smoking around you and it's usually in your face. If you're pregnant, old, young, a baby, they don't care. They're still going to smoke around you. 3, the slowness. People operate on their own time here. They'll get to it when they get to it and you have no choice but to wait. There's no hustle or urgency. They'll take a nap or go to lunch or have a coffee before they get to you. Yet I still don't want to be in the US where there's crippling debt, people can't afford a home, and definitely can't afford childcare.
So Switzerland spends 40% less on healthcare, but lives 6 years longer on average than Americans. So I am a doctor frustrated with the US system, looking at other systems around the world. And right now I'm looking at Switzerland. And so the percent of GDP that the Swiss government spends, or the Swiss people spend on healthcare, is about 11 to 12%, but we spend about 16 to 18% of all dollars in the US go towards healthcare. And they have a private model. There's no public health insurance. It is universal in that the government sets the rules, but you have to have insurance and you have to pay premiums, and how much you pay can be subsidized by the government if you're low income, but their system works. They live longer. They have high satisfaction rates. Yes, there is a high high cost as far as premiums. And that's what the Swiss people complain about the most, it sounds like. But their total amount that they're spending on healthcare is still 40% less than what we spend here in the US. I think their model is very interesting and might have potential to work in the US, but we would need some major reform and probably some lifestyle changes. Our culture is different than over in Switzerland, and that might be one of our biggest barriers to having an awesome system like theirs.
After watching all this comparison, one thing is clear. Every healthcare system has strengths and weaknesses. Many European countries provide universal healthcare. Meanwhile, most residents have access to medical care that is funded largely through taxes. As a result, patients often face lower out-of-pocket costs for doctor's visits, hospital stays, and many essential treatments. While in the United States, healthcare is a mix of private insurance and public programs like Medicare. Supporters say the American system encourages medical innovation, offers faster access to many specialists, and gives patients more choices. Critics point to high insurance premiums, medical debt, and the fact that many families struggle to afford care. No system is perfect. Some European countries face longer wait times for certain non-emergency procedures, while Americans often pay significantly more for healthcare overall than people in many other developed nations. The real challenge isn't deciding which country is better, it's figuring out how to provide high-quality healthcare that is affordable, accessible, and sustainable. Because healthcare isn't just another political debate. For millions of families, it's about peace of mind when life takes an unexpected turn. So what do you think? Should America keep improving its current healthcare system? Or is it time to consider ideas used in other developed countries? Share your thoughts in the comments respectfully, and before you go, do well to like and subscribe to my channel. I'll see you in the next.